Hello, this is Chadi Alraies, fellow from MedStar Washington Hospital Center, and with me is Rahul Sharma. He is an instructional fellow at Swedish Medical Center. Welcome, Rahul.
Thank you, Shadi.
Yeah. We are in TCT 2016. It's a lot of clinical trials presented. We are in an exhibit hall, and we are recording for CardioTube now. One of the biggest things when I talk to fellows now in the meeting, they have concerns about, shall we do an extra year of structural year, or should we do interventional purely, and then in practice, if it comes back, if I need to do it, I will learn it on the practice. What's your thought on this?
Yeah, so that's a really tough question. I know you and I have talked about this many times offline. So I would say, first off, I think if you really need to have passion for doing structural, if you decide that you want to do a dedicated year. And there's so many reasons for that. Obviously, the job challenges with finding a job in the current market, and the challenges with family, financial challenges, etc., of doing an extra year of training. So definitely, if you're interested in structural, I would say you need to really have that passion and dedication to do it, because it is a big commitment. It's very rewarding, but it won't be unless your heart is totally in it. And I think that the interventional fellowship experience that you have is also a function of whether or not it's even necessary. There are some fellows that are in 2-year programs like yourself who, and maybe you can speak to this, but who have a structural year sort of built into the interventional experience. And in those situations, I would say that if what you're really interested in is TAVR, and you've done a fair amount as an interventional fellow, then arguably you may not have to do an additional year of training. On the other hand, my interventional experience was very heavy with coronary and peripheral and some complex coronary. So for me, it made a lot of sense, given my interests, to do an additional year. So the way your fellowship year is structured will weigh very heavily on the practicality of doing the additional year, if that's what you want. Maybe you can speak a little bit about your experience at Georgetown MedStar and how the year is structured.
It's been really interesting. We have like a hybrid year. We prepare the cases for structural cases, TAVR, CLIPS, and then we scrub for these cases. We do research on the rest of the time. So we're really involved with that. And then next year we'll do interventional, which I felt like is very interesting. And the main objective from Dr. Waxman, who led the program, and Dr. Sadath, is to have the knowledge, the fundamental knowledge that you need to walk into the interventional year. So you know the literature, you know what wires you need to use, and then you are ready to implement what you learned from the literature in practice and training. So it gives you one extra year just to implement that, and then when you are in the practice, you're ready to go, which is, I think, it's a unique structure.
Right.
But how about if you do this extra year? There's another thing comes up is, I don't find a job. So how do you balance this? Passion, job, family,
Right.
need to feed the kids.
Yeah. Yeah. So I think there are several challenges that are at play. And if I may, I would refer, if anyone is interested, I wrote a blog recently on the TCT Fellows Forum that touched on this question a little bit. But basically, if you look at the structural job marketplace, kind of like an economic market, you have several different types of merchants. You have people like us who have trained in structural heart. Then you have people who have been doing coronary for many years, and they transitioned into structural with TAVR. Many of them are our senior mentors and colleagues. And then you have folks who went overseas and acquired certain skills, whether they went for a month or 3 months or 3 years,
Yep.
and now they came back with a lot of skill set. So different kinds of skill sets and different kinds of folks in the marketplace as interventional cardiologists practicing structural with variable experiences. And so then the job market is choosing amongst that type of a sample size to recruit. And so depending on the center, they may be looking for someone who has several years of work experience already as a structuralist. Others may be looking for someone who's fresh out of fellowship. And then on top of that, the number of jobs available are very small. So it's a very dynamic and a challenging marketplace to navigate. My tips would be, first of all, your mentors are going to be huge to promote you, to ask their colleagues whether or not they know of any jobs that are available. That's a huge source. Also, certain recruiters that you may have a relationship with as a fellow, transitioning, people who recurrently email you about job opportunities. There are some great recruiters out there who have an interest in helping you, and alliancing with those people is key. as well. And then definitely diving into any research interests you have and using that as a platform to collaborate with senior mentors at various institutions, which also helps to get yourself out there, help to develop your career, further the interest of learning about patient care issues, and then ultimately can also help to build that networking that if a job does come available, people think of you. It's a mix of all these different strategies, and I'm sure there are many others that I've left out that can be helpful. Bottom line, oftentimes it comes down to being at the right place at the right time. And there are a lot of great skilled folks out there who are still looking for jobs because of luck, circumstance, whatever. So it's challenging.
And don't restrain yourself to a geographic area,
right,
as you mentioned earlier to me.
Exactly, yeah, exactly. I think keeping an open mind and being willing to go anywhere is definitely key. Now, there are some of our colleagues who are such powerhouses, not only clinically but research-wise, or they have just a fantastic pedigree, quite honestly, and those folks maybe can be more selective. But for the vast majority of us who have the passion, have the skill, but certainly have to fight for, sing for our supper, so to speak, it's important to have a very open geographic preference and not to pigeonhole yourself into one particular area.
These are all great points, Rahul. Hopefully everybody hears you. This question comes a lot. Everybody is concerned. So we're going to post this on CardioTube so they will see it. And we'll send it to all fellows hopefully we have on the list. So this is great tips. And you have it in writing as well. So for all of you out there, please tune in to cardiotube.net, and this is Chadi Alraies, and with me is Rahul Sharma from Swedish Media Center from TCT 2016.
Thank you.